BMore Lifestyle.
This BMore Lifestyle segment is sponsored by the Maryland Proton Treatment Center.
Every 5 minutes, someone is diagnosed with some kind of gynecological cancer. That's according to the Foundation for Women's Cancer. If you are diagnosed, there are steps you can take. We have a doctor here with us today that's an associate professor of radiation oncology at the University of Maryland School of Medicine. And he is joining us today to talk about proton therapy and gynecological cancers. Hello, doctor. How are you?
I'm doing good. How are you doing today?
I'm doing well. I'm so excited to have you on. So can you talk to us about this?
Absolutely. So proton therapy is a very advanced form of radiation therapy that has some unique benefits, which gives us an opportunity as radiation oncologists to treat the cancer more effectively and reduce the risk of side effects. It's to give you simply a background. Standard radiation when patients get is X-ray based radiation therapy, which can be targeted to a portion of the body, but it penetrates through and through, and that results in excess radiation going to the surrounding structures. Protons, on the other hand, is a very different form of radiation therapy that can be targeted, and we can make it stop at a precise depth in the body.
Initially, I had looked at other forms of treatment,
and as you see here, and that can result in reducing excess radiation surrounding normal organs.
Okay. And how effective is this?
So, good question. And it is an area of technology that has been used for many, many decades. And the technology of proton therapy has continued to advance. Depending upon different types of cancers, there is increasing number of clinical studies and institutional experiences that have shown very promising efficacy of the treatment, not just in controlling the cancer, but also in reducing the risk of side effects from radiation treatment.
Okay, so with this being your area of expertise, can you tell us some situations where, you prefer to use proton therapy over standard radiation?
Absolutely. I'll take this opportunity to highlight that September was the Gynecological Cancer Awareness Month, and we are in the Breast Cancer Awareness Month. So just a quick plug-in for all the ladies listening to the session, advice from your neighborhood doctor that ask your doctor for a pap smear and ask whether you need a mammogram. But moving on, specifically for proton therapy and focusing on women's cancer, we use it for a wide variety of situations, specifically like in breast cancer. Many younger patients that have left-sided breast cancer, patients that have that need radiation not just to the breast, but to the lymph glands under the arm or in the neck area, those who have had prior treatments, and those are common indications. My own area of specialization is gynecological cancers, and we use proton therapy for uterine cancers, cervical and vaginal and vulvar cancers, and some recurrent ovarian cancers as well.
Wow, my mom is a survivor of this too, doctor, so I really appreciate all these tips that you just gave us.
Well, that's very encouraging, and I'm glad she's doing very well.
Yes, she is. Thank you. All right.
On the proton therapy, then for gynecological cancers, one thing that I would also highlight is we at the Proton Center have some unique technologies to be able to treat our patients effectively. We especially use it for ladies who are also going to get chemotherapy, which comes with excess risk of side effects, and proton radiation can help minimize those, whether that's radiation side effects to the bowel, to the bone marrow, and other pelvic and abdominal organs. We also use proton radiations in patients who've had prior radiation, where any further radiation can be risky. And in that setting, we actually use a very unique modality called as deep hypothermia that can be combined with radiation, proton radiation, and make protons stronger and more effective to fight cancer.
All right, well, you guys heard it here first, proton therapy. Thank you so much, doctor.
Absolutely.